Hi, welcome back to my series of CNA New York State videos from ProMetric. Today what I'm going to do is a video on positioning a patient in a supported sideline position. And our patient today is Miss Smith. The very first thing that we always do before we start a skill, because of infection control, is to wash our hands. I will be right back and wash my hands for at least 20 seconds. And remember, don't forget your thumbs. Good morning, Miss Smith. I'm Karen Tam, and I'm your student nurse, and today what we're going to do is roll you on your side. How do you feel?
Good.
Good. Okay. So, one of the first things that you want to do is to maintain patient privacy. The door is closed and the curtain is closed to provide privacy. But for the purpose of this demonstration, I am going to keep it a little bit more open so the viewers can see exactly what I'm going to do. One of the first things that you want to do is overall raise the bed so it's at a level that's comfortable so you're not continually bending over where it does hurt your back. And an important safety fact to remember is whenever your patient's bed is in the high position, you are never to leave that bedside in high position because it is a safety risk where the patient may fall off. Okay, so the first thing that I'm going to do is lower the blankets, and I'm going to lower the blanket so you can see exactly how I'm going to position the patient. The first thing I'm going to do is to move the patient close to me, so when I do roll her over on the side, she's not too close to that edge. And I am going to need some help moving her towards me. Oh, I see Jessley walking by. Jessley, do you have a minute to help me?
Yes, I'm just going to wash my hands.
Thank you. Okay, Jessley. And since I am the nurse taking care of Miss Smith, I will tell Jessley what to do so we are on the same wave and I don't want her to hurt her back. So Jessley, what I'd like to do is if you could take a hold of her bed pad and on the count of 3 with our knees bent, okay, and our legs spread apart, feet spread apart, on the count of 3 if you could move her towards me. Okay? 1, 2, 3. Okay, and I think we're going to do it one more time where I want her upper part a little bit closer to me. Okay, 1, 2, 3. Okay, thank you very much.
You're welcome.
Now that I have Miss Smith close to me, I am now ready to turn her. So now with the aid of the bed pad, I will turn Miss Smith over on her side, hold her there with the pad, and get the pillow and position it underneath her back. I also like to take the pillow and roll it underneath because that will give her the extra support that you will need, and it should keep her in that position for at least a good 2 hours. The next thing I'm going to do is with her left leg bent, I'm also going to support that with the pillow. I do like keeping the open end of the pillow down by her ankles. So I will gently lift up her leg as not to injure her and put the pillow in between so knee is not touching knee and ankle is not touching ankle. Okay? So I do feel like I have a good support for her legs, a good support for her back. This area will get all air to it also. I will now go on the other side of the bed and support her arm. One of the first things that I'm going to do is take a hold of her shoulder very safely and just move her out about 1 inch to make sure that there's not too much pressure on her shoulder because it literally could decrease the circulation. Now the next step I will do is to support her upper arm, and if you notice, I am supporting her arm while I am doing it, okay? And I do support her arm here on the pillow. And again, there is enough room on the side of the bed where it is not dangerous and she should not roll off. The pillow is supported both knees, both ankles. She's on her side. The normal anatomical position is being maintained. The pillow, if you notice, is not only underneath her head. Another important part is it's also underneath her shoulder to give her the support that she needs. I now feel very comfortable that the patient feels comfortable. Do you feel comfortable? So before I do leave the patient, I will cover her up. I will raise her bed up, the head of her bed up. Okay, is that good? Mm-hmm. Okay. And for safety reasons, you always want to leave your call light within easy reach for your patient. Okay, I will come on back on the other side and then just clip it for the patient. Okay, and I will leave it close to her hand. Here's your call light, and it's right there by your hand. Is there anything that you need before I leave?
Nope, I think I'm all set.
Okay. So there's her call light. Always remember to lower the bed. Okay, Miss Smith, I'm going to go now and I'll check on you in about an hour. Okay? And one of the last things that I will do is to wash my hands. Again, thank you very much for watching this video on how to position a patient in the sideline supported position. If you have any questions about this video, you can always refer to Prometric CNA Skills, which you can get online, and it does go over it step by step. Again, thank you so much for watching.